आप सुन सकते हैं मेरे को? All of you can hear me?
Yes, sir.
I think today is a good day. There were 8 people waiting from last 10 minutes. So how is the program? Is it good or it's average?
Sir, it is
How
very
are,
insightful.
so I think this week was the most dullest week. Nobody has done the homework. No one has sent anything. No video. You make the video, you will finish the training because then you can share with the patients. So try to make some videos for yourself once a week, 2 videos a week, just 1 minute video, 2 minute video. You will also enjoy. Okay, so I think
Yes, sir.
now we will start the program in 2 minutes. Just I'll give one more minute for people to join. So today topic is for you. See, you are going to teach us the weight loss diets where you all are experts. I am not expert in that. So you have to teach us today. And I think 2 people have given very good presentations. Yusra has given a very good presentation. Brinda has sent videos, but I told her to be a little bit just basically make it more uh, easy to be sent to the patient. So I think you can try one more time because I think you have a lot of videos and try to make it more simple. Try to make it more attractive, and then we can use it. So I think
Okay, okay.
now we will start. So today's topic is module 5, which is to help you differentiate between bariatric surgery diet, Allurion balloon diet, and weight loss diet. So in the end, I will share my thoughts, what according to me is the best weight loss diet, and discussion is open. So I think we can learn from each other. You can teach us today, be more interactive today, because this top mostly bariatric surgery diet and Allurion balloon diet is a revision, and the weight loss diet is the part where most discussion will happen. So this will be the revision for you. When you are talking about bariatric dietary phases, just remember a newborn baby. Just remember how the newborn baby takes the diet. So there are 4 phases. Phase 1 is clear liquid diet for 24 to 48 hours. Phase 2 is full liquid diet for 2 days post surgery till 1 month or 2 weeks, depending how you are. The patient is comfortable with the liquid diet. Phase 3 is a semi-solid or soft diet, generally started 1 month after the surgery. And phase 4 is a low-fat normal diet, which is initiated about 8 weeks after the surgery. These are the general guidelines for bariatric dietary phases. And always remember a newborn baby when you are giving them a diet, drink slowly. These are the things which can be done in phase 1 diet after the leak test. If your surgeon does a leak test, I do leak test during surgery. And these are the all choices you can give to the patient. Start with coconut water, whey water, clear juice. Generally, I avoid clear juice because if you start giving them juice, they will only take juice. Then clear soups, clear dal water. So this all can be given. Black tea, black coffee. This all can be given to patient. And phase 2 full liquid diet is the one where you can start skimmed milk like buttermilk. Then you can add protein at this time. These 2 things you have to keep in mind: protein and buttermilk. These are the 2 things you have to keep in mind. In liquid, you give them whey protein. We have tried all this Optifast, Obesico, Positrin, but I think the best is the whey protein. So this is a general chart for phase 2. Start with coconut water, then homemade protein shake. You can start homemade protein shake after 2 weeks. Initially go for whey protein. If you are giving homemade protein shake, give it without banana, make it very thin, put 150 ml of milk and half the ingredients like only 10 to 15 gram of chana powder, 2 to 3 cashew nuts, 2 to 3 uh, almonds, and 1 date. That will be enough. Then you can give them in between for changing of taste vegetable juice. Then you can start the buttermilk and chicken soup, and again buttermilk. Ideally patient should take 2 times protein. That should be the ideal. because it will complete their energy or protein requirement throughout the day. Those people who do not take protein, they will feel hungry very fast, as close to as 2 to 4 weeks, and they start munching wrong snacks. So if they are taking protein, they will be always be full. And when they are taking protein, you can ask them to move, to walk. That is known as habit stacking, because if they start walking, the protein will be very easy to digest. So it's two things happening in one. Phase 3, the semi-solid diet, you can start slowly, like just remember the acronym, that whatever meal he was taking, make it one third. If he was eating three rotis before the surgery, you start with half a roti, like a small baby. Ask him to add roti in the dal, make it very soft, and then eat it over 5 to 10 minutes. Remember 32 teeth. They have to eat 32 times, chew 32 times before taking one chapati. So it will take around 10 minutes for them, or 15 minutes for them to finish one meal, which is one third of their original meal, which will start from half a roti to 1 to 1.5 roti at one time. That will be enough. Then you can start with one besan chila at one time. You can start two egg whites at one time, or start with one egg white at one time. Ask them to chew slowly. Then you can start paneer sandwich. Then you can start poha, which has soya bean in it. So these are the semi-solid diets you can start. And if the patient is not taking a lot of semi-solids, ideally one time protein has to be taken. Ideally, you have one time protein has to be taken, and that has to be whey protein or a homemade protein. Now is the best for the patient at this point of time. This is the smart chart, sample chart. Homemade protein shake, followed by oats, dalia, or whatever, that's besan chila, then juice, which is vegetable juice, not the sweet juices which are in the market. Then again, high protein, they can take whey protein in the afternoon, and in the night they can take dal soup. And whenever they are walking, like suppose they are walking in the morning, give protein at that time. If they're walking in the evening, give protein at that time. Then they can do both the things together. Phase 4 is regular diet. At that time, at 3 months, most of the times the hormone changes have been, which were there before, which were not allowing them to eat, has they have gone away. The patient hunger has increased little bit, and their activity level is not there. Then the weight loss will stop. So at that point of time, you have to increase their activity levels. If you prime them before, same thing can happen at 2 or 3 weeks after the surgery. They have started increasing the diet, but they are not doing proper activity, and the weight loss will become stagnant. So you have to push them that come on, now you have to start walking, and then the weight loss will start again. So this is that is very important to revise the videos again, so you remember it. It is easier to remember when you see the videos, visuals. Like this is sleeve gastrectomy. Today we had a sleeve gastrectomy. Patient had come from Australia, and with God's grace everything went well. So if any of you who are in Delhi, and if they are interested in live surgery, you are most welcome to join us in the operation theater. You can see exactly how we are doing it. Then you will remember. I think it will imprint in your brain for lifelong, and then it will very easy for you to prescribe a diet when you see how the procedure is done, how every step is taken care of, and then you see the patient next day and see how the recovery is there. So this is a sleeve gastrectomy where we remove the excess part of the stomach. This is a gastric bypass where we don't remove the stomach, we create a small pouch of the stomach and connect it to the intestine below. So this is a bypass where the food is going into the distal intestine, and glucagon like peptide 1 is increased in the body, which helps doing the functions of insulin. And nowadays, a lot of injections like Wegovy injection or Ozempic injections, they all have GLP-1 as a component. But during surgery, it increases inside the body automatically. Because this food, when it goes to the ileum, the body cells they release this GLP-1. So this is very important to understand that naturally this is happening. So this is how the food is going, and this is how these juices are going, and here the digestion is starting. Normally we bypass 2 meters of intestine, which is very compatible, and there is no problem. Third procedure you can see is a mini gastric bypass. For your understanding, here the bypass is only one joint. There is a pouch like of a sleeve, and then we join this with only one anastomosis, so it becomes a single joint. which makes surgery easier, and the weight loss is similar to RYGB. So these are the three surgeries. Now we go to the Allurion dietary phase. Just push one dietary phase up. So clear liquid diet is sometimes for 1 week and sometimes for 2 weeks. There is a patient now who is already 1 month post Allurion balloon, and he is still on liquid diet, and he wants to continue for one more week. Then phase 2 is soft diet, which is phase 3 of bariatric diet, and phase 3 is normal diet, which is phase 4 of bariatric diet. This is how you can just make it simpler. Like in phase 1, there are teas, juices, and soups. These three things you have to remember: tea, juices, and soup, and protein. Whenever they have no nausea, you can start the protein, which is whey protein initially. This is the chart of phase 1. You all have this chart like whey protein, clear juice, coconut water. Then phase 2 is smoothies most of the times. You can convert the juices to smoothies, soups can become thicker, and at that point you can start the homemade protein now. These are the three things you can do, making it simpler. This is again homemade protein, and smoothies you can add. It is not hard and fast that everybody has to follow this diet. According to their choices, you can change. Try to give them diets daily. Don't give them a weekly diet and leave it to them, because they will stop following you after 1 or 2 days. Change, like give one day broccoli, this one day give them beetroot juice, next day give them cucumber juice, third day give them bottle gourd juice. Same thing you can do with smoothies as well. Now, phase 3 is a normal diet, healthy, negative energy balance diet, which I will discuss in the end. Two things we have to focus on: the right snacks and the right drinks. Like last time I told you, the what are the right snacks and what are the right drinks. No aerated drinks, no diet cokes, all have free calories. So just to revise Allurion balloon procedure again with you, so you remember how it is done. 5 steps Allurion gastric balloon procedure. Step 1: capsule insertion. The deflated balloon is swallowed in a capsule. Once it reaches the stomach, it's inflated with a solution, taking up space in the stomach. Step 2: X-ray confirmation. An X-ray is used to verify the balloon's position and ensure it's correctly located in the stomach. Step 3: balloon filling. After confirming the correct placement, the balloon is filled with a sterile saline solution. This inflation process is crucial for the effectiveness of the weight loss treatment. Step 4: X-ray. After balloon fill, another X-ray is conducted to confirm that the balloon has been filled properly and is in the desired position within the stomach. Step 5: threading. Once the balloon placement and inflation are confirmed, the threads or guides used during the insertion process are generated. So this is the procedure now we have seen, and now we come to the important thing, which is the weight loss diets. I think Yusra has made a very good presentation. Yusra, you cannot speak.
No, sir, I'm having cold and cough.
It's okay. You can just continue with cold and cough. There is nobody judging you here. I
Okay,
don't
so
want to take. I don't want to take your credit. So we have put your slides here. You can just start.
okay. So first we will discussing on ketogenic diet. So my topic is a keto diet. So we
Okay.
will be discussing on it. So जो बेसिकली कीटो डाइट होती है वो हाई फैट होती है, लो कार्बोहाइड्रेट होती है, जो डिजाइन करती है, जिसको हम इंक्लूड करते हैं, उसमें कीटोसिस इंक्लूड होता है। तो हमें कीटोसिस का ध्यान रखना होता है जब हम कीटो डाइट दे रहे होते हैं। एक्सेस ऑफ कीटोन जब बॉडी में हो जाता है, जैसा आपने देखा होगा, पहले भी रिसर्चेस देखी होंगी कि कितने फीमेल एक्टर्स की या किन लोगों की डेथ हुई है अकॉर्डिंग टू कीटो डाइट। कीटो डाइट
Or
चलो
after the presentation, I should ask.
I think you can write it down. We can take all the questions because today it is your day. Weight loss diets. You are the people who will tell us. Just give her. Let her finish.
Yes, sir. Okay.
Yes,
ओके, सो
continue.
हम देखेंगे कि कीटो डाइट कैसे वर्क करती है। जब हम हाई कार्ब लेते हैं डाइट में, तो वो हमारा जो ग्लूकोज लेवल है उसको इंक्रीज करता है। जब ग्लूकोज लेवल इंक्रीज होगा तो जो लिवर जो प्रोड्यूस करते हैं इंसुलिन, वो ग्लूकोज सेल्स में कन्वर्ट होकर सोर्स एनर्जी बन जाता है, और जिससे क्या है, वो जो एनर्जी है वो स्टोर हो जाती है फैट के फॉर्म में। सो अब हम जो हाई फैट लो कार्ब की हम बात कर रहे हैं, तो इसमें हम जो है एवोकाडो,
Yes, yes, continue. Yes, yes, continue.
So she has a network issue, maybe.
Okay. But she is still logged in, so I think she can continue. Mm-hmm. Yusra, you can hear us? I think light went off. Okay. Mm-hmm. Mahi, are you ready with your presentation?
Yes, sir. I have submitted the.
So I think Amir will display and you can start.
Yes, okay, sir.
Just give him 1 minute. Okay, you can start now.
Okay, sir. So, good evening, everyone. I am Mahi, and I'm going to talk about intermittent fasting today. Intermittent fasting involves cycling between periods of eating and fasting. This is a very trending way of losing weight nowadays. But, sorry, can I get back to the previous slide, please? Thank you. This eating pattern doesn't prescribe specific foods but focuses on when you should consume them, which ideally is before sunset, as we know, or we prefer to uh, make our digestive system more efficient and so that weight loss can occur. Can we move on to next slide, please? During the feeding window, the following food items can be included in a typical intermittent fasting meal plan. First, protein rich foods like chicken, turkey, fish, tofu, legumes, and dairy products. Second, complex carbohydrates like sweet potato, brown rice, quinoa, oats, and whole grain bread, which reduces the glucose spike after every meal. Then, third is healthy fats like avocados, nuts, seeds, and olive oils. Vegetables like leafy greens, bell peppers, broccoli, and carrots, which maintain the satiety value in an individual. Fourth is fruits such as berries, oranges, apples, and bananas. Next. It is important to note that the eating window should be used to fuel the body with nutrient dense food that provides energy and promotes satiety. This is very important because while in the fasting window one can get hungry and then they might just binge eat as well, which will lead to repercussions and can lead to again weight gain. It's best to avoid processed foods, added sugars, and refined carbohydrates. Additionally, be sure to drink plenty of water. Now, watery foods like having a water, green tea can be included, herbal teas can be included during the fasting window to keep one's hydration level at check. Additionally, be sure to drink plenty of water and stay hydrated throughout the day. Intermittent fasting is not recommended for women who are breastfeeding, pregnant, or trying to have a baby because the additional energy is needed for nourishing the body, mother's body, as well as the fetus. Next slide. There are many intermittent fasting methods like 16-8 method, 5-2 diet, eat stop eat, the warrior diet, circadian rhythm fasting. Now all of this are very similar to each other, though there are some of the methods which include like 3 days of eating, 2 days of fasting, which is not sustainable at all. But the concept underlying concept is the same, that we need to have a fasting window and an eating window. That is mostly the 16-8 method, which I'm going to discuss. The 16-8 intermittent fasting method involves a daily eating pattern where you fast for 16 consecutive hours and limit your eating to an 8-hour window. Typically, this method does not prescribe specific foods but emphasizes the timing of meals within this designated time frame. So, if you start your breakfast at 9 or 10 o'clock, so after 8 hours, like till 6 o'clock, you can have your dinner, and then that's it. Then again you fast for 6 in the evening till 6 in the morning, that is 12, plus more 4 to 5 hours like till 10 a.m. So the cycle goes that way. So this 16-8 method is the most method. This intermittent fasting approach involves eating regularly for 5 days of week and significantly reducing caloric intake to around 500 to 600 calories. on 2 non-consecutive days. This method focuses on periodic short term fasting for specific days while maintaining a normal diet on the remaining days. Now, this method is involves eating regularly for 5 days. Now, everybody needs food every day, so one cannot go fasting for each day as such. So this method is not sustainable, but it is a type of it. People do follow it. Next slide, please. The warrior diet. Now, the warrior diet is an intermittent fasting approach that involves consuming small amounts of raw fruits and vegetables during the day and eating one large meal at night, typically within a 4-hour eating window. This method is inspired by eating patterns of ancient warriors, focusing on an extended daily fasting period followed by a brief concentrated eating window. Now I'll tell you why warrior. Can anybody guess why warrior diet is not sustainable, or if you think it is sustainable, can anybody please answer? Or does anybody have any opinion about this? Sir, do you have any opinion about this?
Actually, I have my opinions which are very different from a lot of dietitians. So I think we will discuss it in the end what my opinion is about the weight loss diets,
Yes,
because
sir.
it is actually whatever this warrior diet is there. I think it is an ancient diet according to me, where they were limited food resources, and whenever they used to get food resources, they used to drink it and stack it in their stomach, so they don't need
Yes.
to eat again for few hours. Like we also do it during our training. Like when
Yes.
we are training in surgery department, we don't get to eat food maybe for 16 hours or 20 hours. But whenever we get time, we just gulp it and fit the stomach. So we don't need to eat lunch or dinner maybe. So maybe that's
Yes.
the way the warriors used to eat, because with limited food resources.
Yes, sir. And one point is also there कि physical activity अभी के time में उतनी नहीं है जितनी ancient people used to
Yes,
have.
yes,
So
yes.
having
Right.
a large meal at night can massively impact your health and glucose metabolism as well.
Yes, right.
Yes. Can we move to the next slide, please? Now eat, stop, eat. Now this is all what we usually follow while being on a weight loss journey. We tend to be very much motivated, but then if food comes in our sight, then we just binge on it. So the eat, stop, eat intermittent fasting method involves incorporating 24-hour fasting period into your routine, typically once or twice a week. As you can see, incorporating 24-hour fasting periods is not at all possible. During these periods, individuals abstain from food for a full day, followed by regular eating or non fasting days. This approach doesn't specify particular foods but emphasizes intermittent, prolonged fasting as a key component of the strategy. Now, a baseline of all of these diets is just you cannot starve your body like this, like eat, stop, eat. You need to give your body food to boost the metabolism as well. So, this method is not the one I would prefer. Now, the OMAD diet, or one meal a day. OMAD diet is a form of intermittent fasting where individuals restrict their eating to just one meal per day, typically within a 1 hour time frame during the fasting period, which spans like 23 hours. Individuals abstain from consuming calories, relying on water, coffee, or other non caloric beverages. The emphasis is on getting day's nutritional needs in a single substantial meal, which is very much not recommended, or as such we can adopt this practice. Can we move to the next slide? uh, Next one is circadian rhythm fasting. Circadian rhythm fasting aligns with the body's natural circadian rhythms, emphasizing eating during specific time windows that coincide with the body's internal clock. As we all know, that at about after 6 a.m., 7 a.m., our cortisol levels increase and our melatonin decreases. So that is what the circadian rhythm. And during and at 6 p.m. onwards in the evening, there is melatonin that is secreted for us to have rest. So, this approach acknowledges that our metabolism and digestive processes are influenced by the time of the day, which is very true. Typically, it involves consuming meals during daylight hours, fasting during the evening and overnight, aiming to synchronize eating patterns with the body's natural circadian rhythm for potential health benefits, which usually some cultures adopt, like Jainism. So, they usually eat like this. And 16-8 method and circadian rhythm fasting are almost same, where you need to have a proper breakfast in the morning, and then we have eating period till the evening. Can we move to the next slide, please? Intermittent fasting 800 diet. The intermittent fasting 800 diet is a specific approach to intermittent fasting that restricts daily calorie intake to around 800 calories during the fasting period. This method typically involves cycles of fasting and eating with a focus on consuming a reduced amount of calories on fasting days. It aims to achieve the benefits of intermittent fasting while maintaining a low calorie intake on specific days to potentially support weight loss and other health goals. As being a aspiring dietitian, I actually know that 800 kilocalories diet is not at all possible and is not sustainable. For a period of time you may be motivated for weight loss, but then there are repercussions which you have to face, which eventually leads to हैबिट्स और खराब हो जाती हैं उससे. So normal eating patterns से और खराब हो जाती है, and you start binge eating, then you have a lower self image, then you have negative self talk that is happening. So this leads to more on the negative. It has a flip side. What I mean is, can we move on to the next slide? Alternate day fasting method, this was what I was talking about. Alternate day fasting is an intermittent fasting approach that where individuals alternate between days of regular eating and days of significant calorie restriction. On fasting days, individual may consume very few calories or none at all, while on non-fasting days they eat without specific calorie restrictions. This method cycles between periods of reduced calorie intake and regular eating, potentially offering benefits related to weight management and metabolic health. So as you can see on from 7 days, there are 3 days of fasting and there are 4 days of eating. So I don't think 3 days fasting is actually possible for anybody. Can we move on to the next slide,
Odd even
please?
rule.
Sorry, sir.
That that is the odd even rule, right? In Delhi we have odd even rule.
Yeah.
Odd
Oh,
day, odd cycle, even day, even number.
yeah. Yes, sir. So, coming to the conclusion of this presentation, several health benefits arise from practicing intermittent fasting. First is insulin resistance. Of course, by following an eating window and a fasting window, there are less glucose spikes that are happening. So, you control them by eating more of protein and fiber rich foods. Then, next is anti aging. Then, there is brain health, heart health. It has been proven by research that fasting helps reduce LDL cholesterol, blood sugar, inflammatory markers, insulin resistance, and blood triglycerides, all risk factors that contribute to heart disease. Now, heart health or the fat content, LDL cholesterol, and triglyceride levels may not be balanced in a intermittent 800 diet, which includes 800 kilocalories, because 800 kilocalories में restriction बहुत आ जाते हैं, and then the amount of carbohydrate which the body needs is not there. So beta oxidation में भी fat के help नहीं करता, and it leads to, it may be अभी fat diet में नहीं है, so it can lead to gallstones because there is no bile that is secreted because there is no fat in the diet. I hope everybody is getting what I'm saying.
Yes, yes, we are getting.
Yes, sir. Okay. Fifth is inflammation in the body is caused by cells called monocytes. Studies have shown that fasting contributes to reduction in the release of these inflammation markers, which are a key cause of several chronic diseases. And sixth is the weight loss, which is the ultimate goal of every intermittent fasting type. Can we move on to the next slide? Okay. So, does intermittent fasting result in feeling of weakness? Is there anybody that can answer this question?
It depends what you eat when you are eating.
Yes, actually, it was written there. Yes, you
So
need
I am
to
not
feed yourself.
eating.
You need to feed yourself the nutrient dense foods when you are actually in the eating window. So the answer is, as intermittent fasting. Sorry, is anybody saying?
No, no, please go ahead.
Yes, as intermittent fasting involves alternating between eating and fasting, the extended duration between two meals may lead to sensations of weakness, but this can be actually controlled. Like if you have proper counseling for the client, and hydration also needs to be kept in check. It's crucial to adhere to these dietary approach under the guidance of an expert, maintaining a disciplined routine of consuming nutritious food at appropriate times. Next question. Is it permissible to consume water or any variety of fruit during the fasting period? I would mostly say it is preferable for us to consume water during the fasting period. Let us move on to the answer. Certainly, you are allowed to drink water and natural hydrating beverages like black coffee, coconut water, herbal teas while fasting. It leads to what we can say, as we are fasting, it also detoxifies the body. Additionally, you can include water based foods like cucumber in your intake to keep your body hydrated. Third question: does intermittent fasting lead to a reduction in muscle mass? I guess many of you in the meeting must have many much opinions on this, but I'll answer this question. Next slide, please. Research indicates that intermittent fasting doesn't result in muscle loss when compared to other calorie restricted diets unless practiced over an extended period. Muscle loss is more likely due to a deficiency in high biological value proteins. Therefore, maintaining the correct balance of macronutrients is crucial in preventing muscle loss. As I'm emphasizing more and more on this fact कि eating window में बहुत important होता है protein लेना, because the body is already starving for 16 hours. So while 8 hours में तुमको metabolism boost करना है, so when you need to have proper foods and guidance will be provided for the same.
I
Thank
think
you
you have
everyone
done a
for
very good presentation. We all should clap for her. It is
thank
an
you very
excellent
much.
presentation. You did an excellent job. So I
Thank
think
you.
Yusra is ready, so we can finish your presentation. ये तुमने वही लगा दिया ऑफिस कंटेंट फास्टिंग वाला है. Okay. So Yusra, are you there? Your 3-4 slides are left. Okay, no issues. Yusra is, I think, is having a lot of problem in her throats. So I think we can move ahead. So I think this has already been explained. Now, if you ask me, the best weight loss diet for me is a negative energy balance. Negative energy balance is the best diet according to me, because you all said in your presentations that intermittent fasting is for not for lifelong, not for long duration period. Yusra in a brief presentation also told us that keto diet is not for long periods, and a lot of people have died because of keto diets. This has happened with all the diets. This has happened with surgery as well. This may happen with balloon as well. People can die because of obesity. It is not per se diet, but you need a diet which you can take lifelong, which is sustainable. So I follow this Taraju principle. Like you all have bought medicine, fruits, vegetables sometime or the other. So what do you see in a Taraju? They put the weight on one side and the vegetables and fruits on the other side. And when that Taraju is balanced, that is the time they give you the fruits and vegetables according to the weight and they charge money. Same thing is with weight gain or weight loss. Anybody who is gaining weight, there are two tarajus in the body. One taraju is for weight gain, which is the diet taraju. Whatever you are eating will increase the calories and will cause increase in weight. Second taraju is a weight loss taraju, which depends on how much activity you are doing. And if you are doing proper activity, then it will help in weight loss. So if your weight is stagnant, even after surgery, after balloon or your weight loss diets, that means whatever energy they are consuming in their diet, they are only spending the same amount of energy. So if you want them to lose weight, if they are not willing to change their diet, ask them to increase their activity. If they are not willing to do the activity, ask them to decrease the diet by increasing more proteins in their diet. That will decrease the calorie intake. This is the basic principle in all weight loss diets. Whether you do bariatric surgery, whether you do Allurion balloon, or whether you do keto diet, whether you do intermittent fasting, everywhere after some time, whatever comes is a negative energy balance, which is the sustainability diet which over the long term. So if I compare all three, like diet after bariatric surgery, diet after Allurion balloon, and weight loss diets. So first of all, is there any hormone change after Allurion balloon? No. Is there any hormone change after weight loss diet? No. But those who have treated patients after bariatric surgery, they don't feel like eating anything for first 10 to 15 days or a month or few months, because there is a hormone change. Like in sleeve gastrectomy, ghrelin hormone is removed. In bypass, GLP-1 and pancreatic bye hormone are increased, which helps to perform functions of insulin. Ghrelin is an hunger hormone. It is temporarily removed after sleeve gastrectomy for 3 to 6 months. So if there is decreased appetite naturally after bariatric surgery, yes, there is decreased, which may be there for 3 to 6 months. After that, the diet will increase. Is there is decreased appetite after Allurion balloon? Yes, only for 1 to 2 weeks. Is there decreased appetite naturally after for weight loss diets? No, here the effort is more. You have to apply more effort, the patient has to apply more effort, because there is no hormones or no decreased capacity in the stomach which is helping the patient. Is the stomach size has decreased, that is why there is a decreased portion size without any conscious effort after bariatric surgery, even after balloon, but it may not happen after weight loss diet. So have following a weight loss diet and sustainability is most difficult in weight loss diets, because no hormone is helping them, no decreased appetite is helping them, and the portion size is not decreased naturally. It has to be forced. Habit change chances in bariatric surgery are very high, and the Allurion balloon, yes. Weight loss diets, yes, as well, but it is more difficult. And if we go for lifelong sustainability of weight loss, after bariatric surgery, 20% patients they increase weight after 5 years or 4 years, and after 10 years, it can go up to 30 to 40% of patients. After Allurion balloon, at the end of 1 year, 10 to 20% of patients regain weight, and there are data of 2 years, not more than 2 years. I think after 2 years or more, maybe 50 to 60% of patients may regain weight after balloon, who may go for second balloon. We have done second balloons in a lot of patients who have regained weight. But if we go for weight loss diets, what will happen? For 2 months they will take diet from you, after that they will leave you, they will follow next dietitian. We will think that our weight loss diet has worked, but sometimes it may not happen. 80 to 90% of patients they regain weight after weight loss diet. 10 to 20% weight they maintain weight loss diet weight if they are motivated. Weight regain very high in weight loss diets, 80 to 90%. It is also there after bariatric surgery, 10 to 20%. Also there intermediate between surgery and weight loss diets, 40 to 50% in balloon. So now people have added those hormones like GLP-1 with Allurion balloon to decrease this again to 20 to 30%. But there is nothing in the world which can guarantee weight loss and prevent weight regain unless the habits of the patient change. It's very important. So I have now this my take home message for you. Like I have told you, implementation intention. Ask the patient to write tomorrow what they will do, what exact time, where they will go for walking, what exactly they will eat. Then I will told you habit stacking. Stack a new habit with an old habit. Then I told you uh, this 2 minute rule. Whenever you start a new habit, just do it for 2 minutes. If they want to start walking, just do it for 2 minutes and then relax. We have to standardize the this activity or the new activity, and then it will become optimized. Don't try to ask them to walk on the first day for 1 hour. Nobody can do it if they have not walked whole their life. So just start with 2 minutes. Any activity start with 2 minutes. Ask them to do yoga for 2 minutes. Ask them to do meditation for 2 minutes. Ask them to do play badminton only for 2 minutes. Slowly that 2 minutes, once it is done for 10 days to 15 days, it will increase to 15 minutes, 20 minutes, and it will reach 40 minutes. Like I've told you before, if you do more than 15 minutes of brisk walking or anything, then the fat loss starts, the fat burning starts. So this is our presentation for today. I think you people can start us discussing, and there were a lot of questions initially as well. So I congratulate Mahi and Yusra for their very good presentations, and also accepting that all these diets are not sustainable for lifelong. Even surgery is not sustainable for lifelong. Even balloon is not sustainable for lifelong unless the habit changes. And this is another take-home message: is a 2 minute rule. Standardize the new habit rather than optimizing it, rather than making it 1 hour from day one. Start from 2 minutes, slowly go for 10 minutes, 15 minutes, and 40 minutes. Also, in food, you can do like ask them to drink water or a salad plate for initial 1 or 2 minutes before starting their normal diet, so they will not eat wrong food a lot. So I think we can start the questions now. Yes, no questions. I thought today will be the most questions because it is your topic and you will teach us something.
सर मुझे एक डाउट था कीटो डाइट में
Yes,
मतलब
yes, yes. My, go ahead.
यस कीटो डाइट में आई हैव हर्ड कि अगर कार्बोहाइड्रेट नहीं होता तो बॉडी देन मूव्स ऑन टू मसल प्रोटीन फॉर ब्रेक डाउन फॉर फ्यूलिंग द बॉडी मतलब एनर्जी के लिए नॉट फैट फैट इज द लास्ट रिजॉर्ट इसलिए तो हम वॉकिंग 30 मिनट्स करते हैं क्योंकि फैट लॉस प्रोमोट इज
Yes.
प्रोमोटेड आफ्टर 20
हम्म,
मिनट्स 20-25
हम्म।
मिनट्स
तो आपका डाउट क्या है? What is your doubt?
मतलब मतलब मसल कीटो डाइट में द बॉडी डजंट मूव क्विकली टू फैट एज द सोर्स ऑफ एनर्जी नो, तो
बेसिकली
मतलब उसमें मसल लॉस
बेसिक
होता है ना. I-
You want to say that for during keto diet there is a muscle loss.
yeah, is there muscle loss? Because I have heard कि carbohydrate, protein and then fat ऐसे body moves
The
for
dietitians can
energy.
give us the answer. There are a lot of dietitians who have give. I think a lot of them, lot of you have given keto diets to your patients. So what's your opinion?
Yes sir, I want to know what everybody has to say.
Please go ahead. We learn from each other. We
सो
don't need.
बेसिकली मैं ये
Yes,
कह
yes.
रही थी कि जो कीटो डाइट है उसमें जो हम
Uh-huh.
कार्ब्स देते हैं, उसमें जो हम कार्ब्स देते हैं वो सिंपल कार्ब्स देते हैं, उसमें हम राइस अलाउ कर देते हैं, लेकिन बाकी जो अगर चपाती अगर आपको लेनी है तो कीटो आटा आता है तो आप उसका ले सकते हो, आप जो है ना कीटो आटा जो है, या फिर आलमंड फ्लावर ले सकते हो, आटा जो है ना कीटो रोटी के लिए जो है. सो बेसिकली हम कार्ब्स उनका इस फॉर्म में दे रहे हैं, बाकी और किसी फॉर्म में नहीं दे रहे हैं उनको कार्ब्स जो है ना.
So
Okay.
I think for me, if you ask me, you have to go for a diet which can be sustainable for lifelong, which is not a shortcut, and which can give you lifelong results. So that is why I think for me, I have not given keto diet to anyone, so I am not aware how does it work. But you people must be knowing better than me. And somebody has asked which protein is the best protein if we have to give. I will say that whey protein is the best because it has 25 gram of proteins and it is made from milk. And ideally, homemade proteins. I think all of you have seen the videos where we have given homemade proteins. Now we give prescribe most of the time homemade proteins. If they are comfortable, after 2 to 4 weeks, they can start homemade protein, which is the best for me now because they give around 25 to 30 grams of protein and it is all natural. There is nothing unnatural in it. Whey protein, I don't know how the companies are making. Just now there was a red flag that all the proteins there is a lot of additives. So I don't know how they make, but this natural proteins or the weight loss natural proteins we are using we make is are the best according to me. And people may differ. I think somebody has different opinion. They can tell us which protein they are using and according to them which protein is the best. Anybody else?
We can have
Today,
ensure का प्रोटीन पाउडर आता है, if you want you can give that protein powder.
एंश्योर में एक मील में कितने ग्राम प्रोटीन होता है? आप जब भी किसी को प्रोटीन पाउडर whenever you are prescribing a protein powder to anybody, just check the amount of protein that person will get in one meal. According to me, I think Ensure Plus only provides 6 grams of protein in one meal, which is insufficient. 6 to 10 grams. It is better to take 1 or 2 eggs or a glass of milk. Some people put a powder in the milk and they are not able to take it. So I have used Ensure Plus a lot in diabetics, but now I don't use it because the protein content is less. At least in one meal, it should have 25 to 30 grams of protein. Then only it will be sufficient. Any other question to the dietitians? Which is the best weight loss diet? सारे
हेल्दी
लोग चुप हो
बैलेंस
गए.
डाइट, हेल्दी
हाँ जी.
बैलेंस डाइट.
वो तो मैं बोल रहा हूँ लेकिन आप लोग क्या बोल रहे हो? If the
मेरे
client says
अकॉर्डिंग
I
सर
want
मेरे
keto diet,
अकॉर्डिंगली भी हेल्दी डाइट ही ज़्यादा बेनिफिशियल है
Yes,
कि
Uzma is saying intermittent fasting. So how do you think intermittent fasting is the best diet? Yes, yes, go ahead.
Hello.
Yes,
Yes, sir. Hello. Hello. Good morning. Good
yes, yes, please.
evening. So, intermittent fasting has many benefits. It
Yes.
regenerates and overall health benefits. I've noticed this in my clients, and that's why I feel this is very
So you have
good.
used intermittent fasting in your practice.
Yes, sir.
So are you satisfied with the results?
Not for everyone. Like some patients, some clients are very happy
Okay.
with doing that. Some are not because they feel dizzy after some hours of fasting. So it
Okay.
doesn't work for all.
So I think it depends during the meal time what exactly they are taking. Not it is not the fasting time which is important. It is the meal time which is important. If during the eating time, if they are taking good quality of proteins and high protein content, they can continue with intermittent fasting for long. But if they are taking a lot of fats and carbohydrates, I don't know whether they will be able to do the intermittent fasting for a long period of time. So the dietary
Also,
period during the fasting time is the most important, as Mahi has
yes,
also
also
explained. So I agree with you. I
also
think
the
intermittent fasting is not a bad diet. It is a good diet if a good dietitian like yourself can give him good diet sources during the dietary phase. Yes, anybody else?
sir, one more point.
Yes.
Also, the quality of carbohydrate, whether it's simple or complex, it
Hmm.
also depends.
Yes.
It keeps eating it for a long time.
Hmm. Yes, anybody else? Right.
सर इंटरमिटेंट फास्टिंग में बेसिक प्रिंसिपल तो यही होता है कि कैलोरी रिस्ट्रिक्शन अल्टीमेटली हो ही जाता है क्योंकि 8 आवर ईटिंग विंडो है तो मतलब यू डू नॉट मतलब स्नैक जैसा एक मील में ऑप्शन नहीं आता यू हैव ओनली ब्रेकफास्ट lunch and then dinner at 6 a.m. So there is hard barely 4-5 hours gap between the both of them, so you can have liquid
So
foods in
have you
between.
people seen any rebound? People who were there with you, they are for intermittent diet for 6 days, and one day they have a rebound and they waste all the 6 days. Have you
No, sir,
seen?
I haven't. I have my friend which did intermittent fasting and she lost significantly 6-7 kgs, and now she is very sustainable in her eating
Okay,
habits. She
that
includes
is good. That is very good.
milk. Yes, sir.
But when people are obese, for them intermittent fasting is tough because they have habit of eating a lot. They have habit of
Yeah.
stress. They have habit of stress eating. So a person who is overweight, overweight person can, I think, it's a good diet. Keto is this intermittent fasting or a grade one obesity. But a people who are grade three and four, it is very
No,
tough for
sir,
them
it
for
cannot
intermittent
happen
fasting.
with them.
Tejaswini wants to ask something. Yes, please.
It's not a question, sir. It's just an opinion.
Yes.
A person with the diabetes and the hypertension should not have the intermittent fasting or a keto diet. I don't
Okay.
think that gonna work for them. So we have to prescribe them as a dash diet or that is required for high levels of a glucose. So we have to consider those things also when we give a patient a diet.
So you have prescribed best diet to your patients?
Sir, I would
No,
like
sir.
to
I'm
add.
just saying it. I
No.
haven't yet.
Okay, good. I think you are right. Dash diets is for hypertensive patients, but have you described it? Have you got any practical experience? See,
No, sir.
theoretically is fine. So if you have any practical experience, we would like love to share it. And I agree with you that for diabetic and hypertensive patients, it is tough for intermittent fasting as well as keto diets because their sugar and BP will go haywire. Daksha has a question. Yes, please, or a opinion.
Yes, it's another opinion. So
Yes, yes.
basically, similar to what you were mentioning, right? It is very, very, very subjective about what particular diet is good, because these
Mm-hmm.
are all theoretical things. Presentation
Mm-hmm.
is fine, but in practice, a lot of things don't work for a lot of people. For example, intermittent fasting, में a lot of diabetics do get hypoglycemia. So
Mm-hmm.
sometimes we have to keep that in check. But on the other hand, it also gives them a good impact if they are
Mm-hmm.
managing it well. So
Mm-hmm.
also there tends to be a slow down in their metabolism as well. So you'll have to keep that in check as well. So आपको mix and match करके ही करना पड़ेगा. Nothing can work for long term. Of course, they need to have a balanced diet with good hydration, with good physical. Only then it works.
So that is why I tell you just remember a tarazu. Just
Exactly.
tell them that you have to balance this tarazu. If you want to do weight loss, either eat less or work or do more workout. Then only you will lose weight. That is the only way.
Absolutely.
Because if you have a negative energy balance, you will always lose weight.
Right, right.
Yes. Any other question? So I think next time anybody wants to present something.
I would like
Yes. What topic you want?
anything, some two things. work for this particular surgery part as well.
So
Plan
what?
the diet plan as well. It's a Mediterranean diet है. There's few more. अभी हमने skip कर दिए.
ठीक है, तो next time you give us the topic and just make 5 to 10 slides and you can do that.
Whatever
Anybody else,
आपको
whatever you want to teach us, you can teach us.
okay. All
You
right.
can just send the topic to Amir, but send the slides by Friday.
Yeah,
Because,
I'll do.
uh,
Not
anybody else
Sir,
who is
if you may allow, can I have a subject called as nutrigenomics in my curriculum.
sure, go ahead.
So can I just present the genes responsible for
Yes,
obesity?
yes, we will be more than happy to learn. Go ahead. Nutrition genomics. Okay. Anybody else?
So vegan diet?
Brinda,
Yes, sir.
vegan diet. Okay,
Yes.
no problem.
Okay.
So you are making my task easier now.
Hello, sir.
Yes,
I'm gonna go for the dash diet.
dash diet. So I think we have 6 more lectures. So I think we do two next time and two the next time. So I'll just because if there are 4 lectures, it will be very difficult for all of you to stay for 1.5 hours. So you want 4 lectures at one go or two this time, two next time?
I think it's better to give.
Better two each, right?
Yeah.
So I think Daksha and Mahi can present next time,
Yes, sir.
and Brinda and Tejaswini, you can present the next time. Please finalize the topics and send us by tomorrow. Or I think Mahi, you have presented this time. You do the next two next time.
Yeah, sir. It is fine for me as well.
Okay. So Daksha and who else will present next time? Daksha and Brinda.
Me, sir. Yeah.
Okay. Daksha and Brinda will present this time, and Tejaswani and Mahi will present on next time. You want me to include any more thing so that I am trying to make it more simpler so that I give you a take home message by the end, which may help you in your practice and also give you some practical experience. So you learn from us and also teach us. So I
Sir,
hope,
can you sorry, sir, to cut you.
yes, go ahead, please.
Sir, can you just some include like client perspective की मतलब काउंसलिंग करते हो मोस्टली ऐसे बेरियाट्रिक सर्जरी के लिए जो क्लाइंट्स आते हैं
Okay,
तो
so you
मतलब
want
how do
how,
they talk or how do they sound
okay,
to you when they talk and how to tackle
okay.
them थोड़ा.
I think brief I can give you just now, but I will include a detailed thing whenever you want me. So whenever a patient decides for a bariatric surgery, he has already tried diets 8 or 9 times or even more. So when they come, they are very frustrated. They will not speak to you for I think 5 to 10 minutes. Only their parents will speak. If a obese person has come with a family, only the family will speak, and they will keep on scolding that person. So he's already depressed and he already is anxious, and his morale will go down. So my technique is I talk to them alone. If there is a kid, if there is a young child who has come with a mother or a father, I want to talk to that person alone, not with the parents, because if the parents are there, they will not allow the person to speak anything, and then nothing, we will go nowhere, because surgery will happen on him or a balloon will happen on him. So I have to talk to them alone. If a middle aged or an old person comes and they already know their problem better, they come for diabetes, they come for joint pains. In a younger age group, people have to get married, that is why they go for surgery, or they have to conceive, that is why they go for surgery. So both patients groups are different. So whatever, you have to identify their problem is not overweight or obesity. Their problem is the symptom which is troubling them because of obesity. If a female is not getting married, that is her problem. Her problem is not overweight, she is happy with her weight, but because she is overweight, she is not getting married, that is the problem. So you have to discuss with her what exactly she wants. Then if she's hiding it this from her husband or her in-laws, all the things have to be discussed. Then second person who is come is because they are not able to conceive. It's not because they are obese, they are not able to conceive, that is why they are discussing with you. So your focus should be to help them discuss everything in detail. how their pregnancy will go after the surgery. Like we avoid them for 1 year, no pregnancy after sleeve, or 1.5 years, no pregnancy after bypass. Then once they get pregnant, we have to talk to the gynecologist to explain, no need to worry, everything is same, prescribe all the medicines. Third group is for diabetes control, not for weight loss. See, I am honestly telling you, nobody comes for surgery for weight loss. They come for surgery because of symptoms of weight, symptoms of obesity. So patient who is diabetic, he wants to get rid of medicines, or doesn't want to start insulin. That is why he's coming. So we have to discuss according to that. Then there is a group who are in like a third, like page 3 group, who doesn't want 10 kg or 15 kgs. They're only 70, 65. They also come for bariatric surgery, which I refuse because they don't come into that criteria. But nowadays they are getting balloon done because balloon is in their criteria and they can achieve what they want to achieve. So if you ask me, any patient who is obese comes to you, I think you need to give them half an hour to 45 minutes to understand their actual problem. We have done surgery after 11 years of counseling. Last 3 months ago, I did a surgery on a patient I met in 2014. So it happened after 10 years. So people wait, they try everything. Then again, after weight surgery, he's sending me weight loss diets. Sir, can I take this diet? Can I take that diet? Because somewhere I think we are not counseling him enough after the procedure. So once you do a good counseling, the results are amazing. Like we have a patient with a balloon, he's 130 kg. Today is exactly 1 month after balloon and he is down 16 kgs. He's only 114. And he's saying that I will continue the liquid diet for 7 more days. On the other hand, there is a patient who has started soft diet after 7 days. So their weight loss will not be good because they have increased their diet. The Raju principle is there. So if I tell you, you have to individualize which patient is what and according to them treat. Try to become part of their family because there is nobody else. And don't laugh on an obese patient. Don't ever say आपने किया क्यों नहीं, आपके बस की क्यों नहीं, आप क्यों नहीं कर सकते. Don't say anything negative to them because you are their only hope. Their parents are basically after them, their peers are after them, their relatives are after them. Imagine a girl who is 23-year-old and who is 100 kg and not able to get married. The whole world is after her. पतली क्यों नहीं होती, पतली क्यों नहीं होती, you are not getting married because you are obese. Understand her point. So you are female dietitians, you can become a good friend. Listen to her, understand your basic issue. And most of the time she is stress eating because the people are giving her stress. So if the stress is gone, I am sure her weight will go down. She may not require a surgery, she may not require other things. It's the stress which is causing her problem. Once she gets married, she's not able to conceive. Again, people are after her life. So it's a very difficult world. See, always a male wants to marry a thin female, but he doesn't care about his weight. He can be 100 kg, 120 kg, and he wants to marry always a female who should be 60 kg or 65 kg. So ideally, it should be double way around. The male should also reduce weight. He should become compatible to that female before forcing her to lose weight to get married. So it's a society issue you cannot change. What you can change is just relieve their stress by becoming their friend. And these weight loss people are after your life because all the stress they will put on you. I have gained weight, you are not giving good diet. Don't get angry on them. There are times when people after surgery they come and say, "Sir, आपकी सर्जरी तो खराब हो गई, कुछ नहीं हुआ हमें, 1 किलो भी वजन नहीं कम हुआ, 2 किलो भी वजन कम नहीं हुआ." That time you should not scold them. Listen to them, try it with them, try again and again, try again and again. It is better to try than not to try at all. At least they want to become healthy. A person who has gone to the gym is better who is at home, though he may not do anything at gym. But after some time he may start doing it. So don't discourage anyone who is even trying to lose 1 kg of weight. And don't judge anyone. I have seen a lot of obese and overweight people to be very, very intelligent. And if you treat them properly, they will be your friend or a family for lifelong. They will get a baby, they will call you first. They will get married, you will be the first person to be invited in their marriage. Any good thing they will always share with you. We do bariatric, this gallbladder surgery. After surgery, I think the patient may not meet me for lifelong. We do hernia surgery, patient may not meet me for lifelong unless there is a problem. But in bariatric surgery, whatever happiness they will have, they will always share with you. So that is why I am attached to this, because it will change life. It changes life, it changes the whole family, it can change society. So I think this is enough. Thank you very much. Next time we will meet for the next module, and people should be ready for their presentations. Good night.